new one for some reason, and my new one for some reason I can't get the camera to work. So again, I apologize.
No, it's okay. Well, let's get started. Hi everyone, my name is Aisha. I'll be leading today's up-to-date podcast on Rockford Community Triage with Dr. Schriever. Before we get started, if you haven't already, did the free survey. It's in the comments. Michelle will be collecting your questions in the comments, and they will be addressed throughout the session. So I'm very pleased to introduce our guest today, Dr. Schriever. Dr. Schriever completed his PharmD here at USC. Upon graduation, he completed a PGY1 at Jesse Hospital. He then went on to complete a 2-year fellowship in infectious disease pharmacotherapy at UIC. After his fellowship, he joined Loyola University as a clinical pharmacist. He was involved in antimicrobial stewardship, infectious control, and medication. Dr. Schriever joined UIC as a clinical assistant professor and joined as a clinical pharmacist at Crusader Community Healthcare. His work with UIC, in addition to teaching, involves research in infectious disease and many campus-related projects. So welcome, Dr. Schriever. Can you tell us a little more about yourself and how does your day usually look like? And what changes has occurred, especially due to COVID?
Well, it kind of changed a lot. I mean, my practice site at Crusader Community Health, which is not primarily, is an ambulatory care setting. And there I am the chair of the infection control committee. So actually I have found that since the COVID outbreak has started, I'm more busy now than I was with my teaching responsibilities back in the day. My responsibility there started in, as far as the COVID getting into the February, where we were all starting, late January, early February, we're starting to hear about the coronavirus and COVID-19. We just use those interchangeably. Although COVID-19 is more correct because there are a number of different coronaviruses. So in January, it really started to, we were asking the question, is this going to be as much of a problem here? And we had a little bit of time, unlike in some of the places where, especially China, where it started hitting first, there was a little bit of writing on the wall that we knew something was going to happen, or potentially did. We saw what was happening in China. We thought we could get ahead of it, but we were able to start asking some of these questions. So a lot of what I did initially was planning. How are we going to take care of, and at least in my clinics, HIV, hepatitis C, how are we going to still care for these patients? How are we going to see these patients? And the hat for chair of the infection control committee, how am I going to enable other providers and for the Crusader health system to see patients? So generally, that's how my day initially started. Now it's kind of transitioned to, I had a myriad of responsibilities. As everybody knows from seeing the news, one of the big pushes has been, and we hear these new terms, flattening the curve and testing and all this. And a lot, where we are having particularly high activity, or where we would like to do aggressively contact trace, we need to have very aggressive testing. Testing in the beginning, at least in February, March, was kind of hard. From doing some pandemic planning back in the past, I had suggested, look, one of the ways that we're going to have to do this is by setting up a tent. And at the time, I give the chief operating officer a little bit of grief because he laughed, because this was in February, and it was we're really going to set up a tent outside a clinic. And I said, well, yeah, we're going to have to. Fast forward 2 months later, and it certainly wasn't my idea. I had seen that the CDC had done these types of activities before, and I went to a couple trainings where they have done these. So I certainly took it from that. But a lot of my earlier days were devoted strictly to preparing and planning. Today, it's kind of more oversight. So with the different testing tents that we have set up, we have a group, myself, Dr. Hayes, 3 other members from the College of Medicine were instrumental at setting up the testing site here at UIC. Unfortunately for us, we laid everything out, said how we were going to do it. National Guard and the Illinois Department of Public Health said, this is a great idea. Can we be involved? And as time went on, their involvement got greater, and kind of at the 11th hour, we lost control of the site. They ended up taking it over and said, well, how about if we run this? So there again, a lot of planning involved, but not as much oversight with this one. At the site at Crusader Community Health, which does the same type of testing, there I'm involved in primarily sample acquisition, which is kind of a nice way of saying sticking swabs up people's noses. I haven't done that before, but we find that during a situation like this, and I hate to use some of those catchphrases, all hands on deck, there's so much low-hanging fruit as far as where you could use your services, where you could help, where you could participate. There are very few manuals and recommendations. There's kind of a skeletal system on, or diagram, so to speak, on how the testing, triaging, everything else should work in a situation like this. But exactly where the pharmacist fits in, what do you do? This could be many places. So in order to, I guess, how does my day begin? It's kind of more moved from planning to kind of oversight and contact tracing at this point.
Okay.
So if anybody has any questions, by the way, please interrupt. And, because I'm trying to use the messages, and I am so absolutely paranoid that if I delete something, I'll end up losing myself. Should I go on to question 2?
Yeah, so you kind of already answered this, but maybe a little more about how this whole triage came to be.
Well, again, we decided that we were going to do it from a college standpoint. We not as large as what they what the National Guard and the Illinois Department of Public Health have now, but a little bit a smaller scale. Instead of the capacity to do up 750 a day, we were looking at a capacity of 200 a day. Same drive-up model, so on and so forth. When we ended up working with the county health department at the COVID site here, what was attractive is we had a lot of the ancillary services that the county, as well as the National Guard, could produce are the supportive services, traffic direction, the infrastructure, making sure the tents are up, and all these other things that we need in order to properly do and run a testing and triage center. So it seemed like kind of a match made in heaven. The other thing they brought is they said, we can get a lot of samples. Laboratory samples in the beginning and everybody has seen the news, has been hard. A lot, I know that we have certain individuals that are saying that there are enough testing supplies. There's not. That's why we have limits on how many we can test per day. Part of it is based on the number of the number of cars we can handle a day, but also the number of specimens that we could get. So they ended up seeing our idea. We saw, what they could bring, and then we kind of melded the two together. So from there, what difficulties have you experienced leading the Winnebago? Well, the difficulties that experienced, because we thought, again, it was going to be kind of a nice marriage, the best of both worlds. We have healthcare providers, we have This could be a great opportunity for students and faculty to precept with the support of Illinois Department of Public Health and the Illinois National Guard. Problem is once we kind of made that marriage, we lost control of the site, and the state of Illinois took it over. So that has been was difficult for us. We had numerous research endeavors we were looking at that we wanted to do, and simply once it got out of our hands, we weren't allowed to do this anymore. So that was very disappointing on our part. Let's go to question 4.
Sure. So can you please describe how pharmacists or pharmacist technicians are involved in this response?
Well, at least from the and again, the 2 testing sites we have here, it's the site at UIC Rockford that has the oversight by the County Health Department, State of Illinois, and the National Guard. There's nothing really medical about it. I mean, very little. There's the people who are obtaining the specimens. It's the patients. So they give you your swab, say go at it. You swab yourself, and they hand the specimen in, and there's very little information and contact between the patient and those working in the triage center. So the pharmacists there have not been as useful. Same with the technicians. Over at the site, and I'll do in contrast to the site that Crusader has, the pharmacist myself, I am certainly one who is actively swabbing patients. We have been, the pharmacists have also, and we don't have as many at Crusader, but have also been there at the tents to help answer questions, for those patients that come in that are acutely ill. They've been working side by side with their other professionals, the mid-levels, as well as the physicians during this process. Let's see, what else was I? Yeah, go on, I'm sorry.
Yeah, so I guess you kind of described how the testing is done on the drive-through. Can you elaborate that on a little more? And also you said they swab themselves. Like, is that for safety reason? Is that how all the other testing centers are doing it?
The one at UIC is definitely based on a safety to minimize the risk of aerosolization of the swab. It is, and we know that it is not a perfect test. We've seen a lot of press talk about how we have false negatives and whatnot. And it seems that a lot of this is based on how well we get that nasopharyngeal swab, how well we get that nasopharyngeal sample. So when the patients are, as they drive around and they're triaged for, initially we wanted to do only those patients that were positive. And again, the reason that we wanted to do only positive patients is that the test seems to be more accurate in those individuals who are positive with symptoms. As it stands now, anybody can pretty much come up because we're just trying to figure out who has the virus and who doesn't. So anybody can come up, they drive around through a tent, they give their demographics, they're given a swab and a container, and they're told to go swab themselves. And then the test gets sampled and they get notified later. In contrast to Crusader, we have a provider, which I've been acting as, and somebody actively getting the sample on the patients. We've also been looking for the patients who are symptomatic to kind of maximize the sensitivity or specificity of the test so that we have less false negatives.
Okay. So I guess a follow-up question to that will be, how quick is like the turnaround time for this? I believe the website says 500 individuals tested. And you said your max is around 200, I believe. Is that when the supplies run out, or what determines that?
What the county has been doing is all of the test results, whether they're obtained here at UIC or Crusader Community Health, that center, they are forward. All the test results are shipped off to Winnebago County Health Department. The county health department, and actually I should have mentioned this, is the jobs for pharmacists and pharmacy technicians have been integral and playing a large role. And we've had students do this as well in the contact tracing. When with the turnaround time, and let's say we use 5 to 7 days, as the tests become positive, the results go back to Winnebago County. It is one of the volunteers, pharmacists, pharmacy students, medical students, who calls the patient and says, you have a positive test result. By the way, where do you live? Who are you around? And get and trace that contact back to see who else might have been exposed. So it varies. You're usually finding out your positive results within a week. If you're negative, those have been kind of, we'll tell you when we get around to it. It's not quite like that, but they're definitely giving more. They're trying to get the positive results out to those patients first, and then hitting the negative ones as time permits. Has the testing goal of 500 been reached? It hasn't. It hasn't, and that's not because they don't have the ability. They just, people are it's up to traffic. I mean, we've had a couple upper 300s, low 400s, but it kind of waxes and wanes. As I look out my office window, the traffic's not that backed up today.
Okay, well, that should be a good sign. The next question is about a report that we saw on May 6th about around 2,000 specimens going missing. And then they were...
Yes, they have... what happened is, and again, this is... and it was a bit problematic because it's the UIC site, and we helped plan it. The laboratory testing, though, this is run through the state of Illinois. And the lab that they chose was their own lab, and that's where they got the samples. This is in conjunction with the National Guard. All of those samples were sent out. It was reported in the news that they were lost. They were not lost. The samples were run, the results came, and as best I can find out, they were, or I've been told, they were just put in a pile someplace and nobody bothered to get them, straight down the chain to where they had to be notified. So they were, so to say they were lost or misplaced, they weren't. The specimens were never compromised. However, the results were not reported to the county in a timely fashion at all. And that, again, has been an issue. Well, it's an issue for University of Illinois because it's got our name on it, and everybody assumes that University of Illinois is running around losing specimens. We weren't. Specimens were always there. And a lot of angry people were calling up. I had somebody calling up my office phone and swearing at me about their specimen. And I wish I could help you. I don't know who you are. So that was an issue. It also we've seen how there are definitely two sides to this whole COVID thing, and as you look at we've got the people who want to reopen, we've got the people who don't want to reopen, we've got the people that say that this is a big deal, we've got the people that say it's not. If you're old, stay at home. I mean, we've seen kind of every the whole spectrum of responses you could have. What this caused, I think, is it caused a little bit of distrust. And so now we have some people who are skeptical, some people who think that, this really isn't, that they have their tinfoil hats on and to keep the aliens from stealing their thoughts, and they think that this is a government conspiracy. because of that and because of not having the specimens, it only cast doubt in many individuals' eyes that this was really run the way it should have been run. And I'll say, even though that we were involved in the planning and not as much in the frontline acquisition of samples, I still think they're doing an excellent job. So, long answer, yes, it has been, all of that has been resolved.
Thank you. So our next question for you is, you kind of answered this already, but what steps would the patient take next after they test positive?
If you test positive, and this again is what we've seen the pharmacy students, medical students, pharmacists, physicians, which is probably a better use of their clinical knowledge, calling that patient directly and saying, Joe, Mary, whatever your name is, you've tested positive for corona. Oftentimes they, yeah, I thought I might. What signs and symptoms have you had? Who have you been around? Have you been outside of the area? How many people live in your household? Where have, and then we kind of look back and figure out what they've been doing for the past 2 weeks. If we, think that they've had a significant exposure to somebody else, we will encourage, we will try to find a way to notify other individuals that they should consider coming in for testing. And they should watch, I was at a birthday party for my grandmother, and 2 weeks ago, and that's the only place I've been, and I started, kind of looking back and figuring out who else could have been exposed, notifying other individuals, and making sure that they come in for testing. We have no treatment. I mean, we do have a treatment. We talk about, we can sit and talk about some of the IV formulations and whatnot when you're hospitalized. But the basic, if you're symptomatic and you're not too severe, it's supportive care. So it's going to be talking to the patients, telling them, hey, listen, it's going to be Tylenol, ibuprofen. Here's what you're going to want to think about doing. Here's what you're going to look for. And you are going to feel bad. And when you feel bad, just realize you're going to ride it out. See how, you're going to feel crappy for a while, but it's going to, and unlike the flu, might take 7 to 14 days before you start turning the corner. The other thing that we have, since we're telling them their results and giving them kind of a little bit of information about it, once you start developing shortness of breath, have a very low threshold to go to the emergency room. That can't be overstated enough, the amount of responsibility that it takes, because if we looked at everybody and said, well, you feel bad, go to the emergency room, we know that that has been a concern, and especially in New York, that has been particularly problematic. So we have to educate the patient on what they need to look for. What's their threshold for going to the emergency room, and kind of when can they expect resolution of this? And there's a lot of the unknowns. There's a lot of, can I take vitamin D? And well, you can. It's not going to do anything for COVID. So reassuring the patient. So finding their contacts and reassuring them.
Yeah, I agree. For those of you that are wondering, just to be clear, the testing center is on Rockford UIC campus grounds, but it's like nowhere near the building. No one's allowed to go in the health sciences building. Once the schools start, and if this continues, or if the state reopens, what do you see as the future of this testing?
Of this site?
Yes. Of this particular?
I don't know. I was asking, and it's a good question, and I think it's one of the $1 million questions. I don't think anybody knows. I think it's going to have to stay open in some capacity, because we sit and we look at numbers, and if you look at how many positive samples a state has, while you could say Michigan has more positive samples than Illinois, and I'm just pulling this out of the air. That is all kind of governed by the amount of testing you're doing. So let's say we have not tested enough patients in our area, and state opens up in 2 or 3 weeks, or a week, whatever it is. And we need to go back and and we find out, whoops, we have more kind of out there than what we thought. We really need to ramp up and see who these infected individuals are. I think you're going to have to keep it up and going in some capacity. I think as far as closing down, and again, these are what the experts are saying. There's a heck of a lot of smart people out there, and if you listen to them, and the opinions differ, but almost everybody seems to think this ain't going away and it's going to come back. Because of that, I think that tearing down, we have to be at least a little bit cautious, because we want to be able to ramp up if and when this rears its head again. And it, at least by, from what the experts say, this is something that we can expect to see through the end of this year.
Okay. Well, now for a more
Paul's got a question. Does the state pay for these? Yep. None of this is either here or Crusader, either site. Crusader's testing, the supplies are the Illinois, and I'm trying to remember this, the Illinois Department of, not Public Health, but it's a community, like FQHC Foundation are pushing them to test. So all of their samples are paid for. The ones here are paid for as well. So there is no cost. To answer Paul's question. Question 9, how can we as student pharmacists help during this pandemic? What I was encouraging, and we've seen pharmacists here in Rockford, there is a committee called the MRC, Medical Reserve Corps. And students have been volunteering for that, and Winnebago County has been utilizing students. I've had a few pharmacy, a few medical students out on the triage tent with me at Crusader. Again, here at the UIC site, they have most of the personnel through Winnebago County Health Department and the Illinois National Guard. Crusader doesn't. They don't have as many, so they have to rely on volunteers. I've been encouraging students to do that because they get a little bit more hands-on. I've also been encouraging students to do that because they were used in contact tracing. While we don't, I think sometimes we don't realize how much from a clinical standpoint that we've picked up during our years in pharmacy school, even if we're only a first or second year. And the way that you look at the problem and whatnot, and that little bit of medical knowledge can really help. Because as far as triaging and care and everything that we're doing at this point, it's much, much scaled back from what we would think. So there are lots of opportunities. You just have to raise your hand. Let's see. I had 3 questions that were asked. Let's see. We got Paul's. Does the state pay for it? Yeah, it shouldn't be any out of pocket. Cat Hayes, in your opinion, what can be done to slow down the spread of COVID in congregate settings? Hand hygiene, wearing a mask. I mean, that's all you can do. Proper sanitation is just a must. What do you think about the result of the phase 1 trial of Moderna's vaccine? I'm encouraged. The COVID virus, and remember, viruses in our immune response, we have B cell, we have T cell, and they're kind of hand in hand. What they are measuring in that, and it looks promising, is they're looking to see, can you make neutralizing antibodies to the virus? Okay, I haven't read through all of it, but this is the gist I'm getting. And it looks like the patients were able to mount a significant antibody response, which is good, because you want to give the vaccine, you want your immune system to respond. Your antibody response is your B cell response. What's your T cell response? And so one of the things that the study is lacking, it shows that your body appears to be responding the way it is. Okay, now what happens when we give you this vaccine and you see the virus? Now what's going to happen? And that's going to be the $1 million question. So clinically, because we cannot measure all of the immune mediators, reactants, and cells in patients that we give the vaccine to, and tell what's going to happen when you actually see the virus. So that's going to be the $1 million question.
Is there any more questions? Okay, seeing none. Thank you, Dr. Schriever, for a great discussion. I want to thank everyone for our up-to-date COVID edition discussion with Dr. Chris Schriever this week. Please help us refine our podcast series by answering these 1 to 2 minute post-survey questions. I think Paula will post them in the comments below. With that, if there's no more questions, I will end this podcast. Thank you again, Dr. Schriever.
Anytime. Again, and I apologize for my technical difficulty. I'm not even going to blame it on the computer. It's my own.
It works perfectly now. I'm glad it worked out.
Now it's a little bit better, but you know, I've said before that I don't think this is going to be the last time we're going to see something like this. Mm-hmm. You know, we look at the avian bird flu, and we look at SARS and the rest of this. I think this was due to happen. I don't think this is going to go away. Experts certainly say it's not. So I think getting involved with your local health department, and I know with at the Rockford campus, it's a little bit easier just because of the size of the community. It's easier to get involved in some of the volunteer activities. For Chicago people, if you have interest in volunteering for the Medical Reserve Corps, I can get an email for an individual. His name's Rob Bland. He's with the Winnebago County Health Department. He will take names as well. I mean, Chicago is well, we know how far that is from Rockford. It's not too far, but if you want to volunteer, if you want to, whether it's contacting patients, whether it's walking the streets and handing out flyers, we know that there are certain high risk areas in Rockford where patients there's not a trust of the medical community and providers. And we have to go out there and physically walk out there, hand out information, and educate patients. And that's one of the things that where you are in your career, you have a very solid foundation. And I think that there's numerous ways to contribute. So I would really encourage everybody, if they get the chance or if they would like that number, I can certainly send it off for you guys to volunteer. So, and that's my, I guess my last, get off my soapbox about volunteering for community health and whatnot. So thank you for letting me come and speak, everybody. I enjoyed it.
Thank you so much, Dr. Schriever. Okay. With that, I will end this podcast. Have a great day, everyone.
Thank you, everybody, too.
Bye.